So I'm going to be presenting. And well, Angela, do you want to explain how we're going to do it? And I will start sharing my screen.
Sure. So what we're going to do is Petra's going to share her screen. Everybody, I will turn everyone on to mute if I can. If you haven't already muted yourselves, I will turn you mute. Petra will share her screen. If you have any questions, please share them in the chat box at the bottom of your screen. There should be a little box that says chat. So you can ask questions here and we will answer them as we get through the procedure or at the end. We'll see how we do that. This is the first time that we've had this many people on a webinar, so it's kind of a learning experience for both Petra and I, so we'll do the best that we can. And that's pretty much it. So Petra, go ahead.
And you can change your view that you only have a small speaker window, so you can see the slides better. So what I'd like to talk to you about today is I want to explore why we share our stories, and my hidden agenda that I will be upfront about is that you will be inspired to share your stories and give presentations maybe to a small group of friends or a church or a Rotary Club or something along that line. Now, you don't have to have a PowerPoint, you don't have to have anything. You have to have a story and a photo of your child, and that's all you need. But if this presentation is something that interests you and you'd like a copy or a version of it, we can present that for you as well. So that's kind of a bit of the underlying agenda. So what I will start with is tell you why we share our stories, then tell you Danny's and our family story, explore the drug poisoning crisis and the importance of harm reduction and drug policy. I'll go on to drug safety and discuss advocacy and support what Mom Stop the Harm does. And I'll finish off with our goal and our final message. And my aim is to do this in about 45 minutes. And Angela, you will have to give me signals because actually I left my phone in the kitchen, and with this full screen, I can't even see my clock on my computer. So the question is why we share our stories. And Angela, you are recording, right?
Yes.
Yeah, and then everybody knows that we are recording. I think you got that all by email. So hopefully everybody's okay with that. So why do we share our stories? So much of what we do in drug policy is based on morals and societal standards and beliefs, and actually not evidence. And this is really, really hard to shift, to get governments, policymakers, the general public to actually look at and consider and make decisions based on the evidence. And a lot of that is around stigma. And stigma makes it also really hard for people to speak out, especially people who use themselves are highly stigmatized and often have a hard time speaking out. What is great is that many groups do. In the first line here, like you have Kaput, Crackdown, Vandu, BC Yukon, Hand Up for Halifax. These are all groups of people who use drugs. And they are very, very active advocates, and they're much older in their advocacy as we are. Vandu has been around a long time, and they've been instrumental in getting harm reduction going in this country. And then there are family groups like us and FAR, Families in Addiction Recovery. There's Families for Sensible Drug Policy in the US and Anyone's Child in the UK. And Canadian Students for Drug Policy, CSSDP, is a student group, and some of the students in the group are also people with lived and living experience. What is important for us to remember is that families and individuals, we can change the narrative. We evoke empathy in politicians and policymakers. And how we do this is by sharing our stories. When I was involved in the proposals for the supervised consumption sites in Alberta, I gave about 25 presentations with our group. And there were physicians and there were scientists and there were harm reduction nurses and a lot of experts. And the politicians or whoever it was, they would nod and say, yes, yes, yeah. They would listen to the evidence and sort of consider. But when I started to speak, I'd open up my picture of Danny and I'd say, here's Danny. And he was 25 years old when he died. And you could see a change in the facial expression. And as I often said, the politician left the room and the dad or the grandpa or the mom or the auntie arrived, the human being arrived. So our painful stories, and especially the images of our children, open hearts, and opening hearts leads to open minds. And open minds will hopefully start considering the evidence. When I speak, I always start here, and you may wonder why. These were the TRC hearings in Edmonton in March of 2014. Now, that was roughly a month before Danny died. And I had considered myself very informed about Indigenous issues and thought, well, this will be interesting to hear, but I didn't expect surprises. What blew me away was sitting in a room, sitting in a circle, sometimes maybe with 50, 80, or 100 people, and having these survivors and intergenerational survivors tell their stories, how that impacted me personally. I walked away with a sense of duty that I had to not just listen to their stories, but act and make reconciliation a reality. And then 1 month later, when Danny died, and I will tell you more about Danny in a moment, as many of you have probably experienced, I thought, why do I have to get up? Why do I have to speak? Why do I have to eat? Why do I even have to breathe? Why do I exist? You question everything. And then one morning I woke up and I don't know where it came from. Sometimes I think Danny sends me those messages. I woke up and I thought back to the TRC and I thought, wow, I've lost one child. And this is the most horrible thing that has ever happened to me. But there were people who've lost so many loved ones and have experienced such horrors and have lost so much themselves, lost their culture and their entire families. And I thought, these people, they're walking, they're talking, they're sharing their stories. And so there is incredible resilience in us as humans, but I also discovered that there is incredible power in stories, and that is what we have to use. And now to our story. Our youngest child, Danny, died from accidental drug poisoning in 2014. He was 25 years old. Danny was in recovery when one more pill, which he thought was a fake OxyContin, but in fact was fentanyl, took his life. He was one of the early victims before fentanyl made the news, before there were health warnings. Those came several months after his death. After Danny died, we had many difficult decisions to make, but we decided to be open about his death. We wanted to end the silence and the stigma. Friends and his family and his workplace were surprised. Substance use is often a hidden condition, and Danny was a master at disguise. What worked for Danny was opioid agonist treatment with methadone combined with cognitive behavioral therapy. The counseling with a psychologist we paid for privately because that was not available through the public system, which the only thing they offered him were NA groups that would not have taken him on methadone. And many still don't do that. What did not work was that both he and we were keen to have him drug-free. And he did not stay on methadone long enough to be stable. I have since learned that methadone and Suboxone are not just another drug, but vital medications that allow people to live in recovery and stay alive. For a while, it seemed like we had the old Danny back, the kid we knew before he became dependent on drugs, the kid who wanted a cactus for his birthday when he was 3, the teenager who had his first collector car even before he had his learner's license, and the young chef who put final touches on my meals and always made sure my knives are sharp. He looked like a successful young man on the outside with a great job in one of Edmonton's best restaurants and a cool downtown apartment. But inside, he was still struggling, and his drug use as a way of dealing with his severe social anxiety. Still, there were other risk factors: a learning disability, being gay, working in an environment where drug use is prevalent, and being impulsive and risk-seeking. One of the most significant barriers to providing more effective supports is stigma. Many people see drug use as a self-inflicted problem, an overdose as something the person brought on themselves. It is stigma that causes people to use and die alone. And if we stop stigma, we can save more lives. This is a collage, and some of your children are in this collage. It's one of the earlier ones of our members. We have more photos on our website. And if you have a photo that you'd like to contribute, you can get in touch with Angela on that. These young people are the loved ones that we miss. And what we have learned is that substance use and overdose can affect anyone, but it affects some people more than others. Indigenous people and racialized people are disproportionately represented. If there's one demographic that's most at risk, it's young men.
Uh-oh.
I think we've lost you, Petra.
I can't see anything.
That's the problem with being in Germany and having a sketchy internet connection. So let's see, hopefully she'll be able to come back in and join us again.
Oh,
Yeah, she's gone. So she's probably rebooting. So who wants to do a dance? Tap dance.
you go ahead. You go ahead.
It was like yeah, it was kind of a little bit awkward because it was sort of, you know, that's a tough spot to lose her because, you know, talking about Danny and bringing up the stories of our own losses is always difficult. So I just have one quick question since we're waiting here. I just wanted to ask Craig's chick, what is your actual name?
So it's Marilyn.
Marilyn, what's the last name?
Marilyn Chick.
Okay, good. Just so that I know, because I didn't have a Craig's chick on my list. So thank you.
Thanks.
And I'm just waiting for Petra to come back in. So hopefully she'll be here shortly. Let's talk about the petition. Does everybody have a good grasp of what that petition is all about? We're really hoping that advocates can send that to their MP with 25 signatures. That's all you need. I know it's difficult now with COVID, but we've had a couple of people who have actually, what they've done is they take the form and email it to their friends and family and just have them fill it out and then email it back. So you don't even have to, it's completely contactless. You don't even have to get in touch with anybody. You can do it that way. And it's really important to get some of those petitions into the House of Commons. It's pretty powerful when they read them out. So keep that in mind.
I do have a petition going and I've got about 9 signatures on it so far.
Perfect.
So,
yeah. Well, that's good.
Yeah.
We're just going to keep plugging away. I'm hoping that my MP in Edmonton, she's supposed to present it today. So we'll probably have some information on that later on today. So that took me about 2 months for her to actually present it because we got our signatures at Overdose Awareness Day. And I gave it to her shortly after that. So we're now end of November, just about, not quite. Oh yeah, almost the end of November. So it's taken us that long for her to get it in. So
Angela,
I am wondering if Petra is going to have to restart the group since she's the one that was the host, was she not?
no, I'm the host. Yeah, so
Okay,
she'll
so-
be able to just join, but she just sent me a text saying, I will be a moment, have to reboot, get people to chat.
So Angela, can I ask you a question? It's Tamara here.
Sure, yeah.
Okay, good. You said that you sent an email to people and they emailed it back to you. I thought we needed the original signature to send.
Well, if you send the copy of it to them and they sign it, you can generally photocopy it, and most printers right now are pretty good that it will look like an original. If you print it in color, you know, if the signature is blue, you can certainly print it in color. And I don't think the MPs, unless they're a real staunch, you know, conservative, I guess, if you want to say that, or somebody who doesn't believe in it, they won't submit it anyway. So it's worth trying, you know, and you can send it to multiple MPs. You don't have to send it to just yours.
Oh, really?
Yeah, you can send it to other MPs as well. So
Oh,
if the MP that you choose doesn't do it, you can always send it to someone else.
Okay, if the MP you choose doesn't do it, you can send it to someone else. But
yeah,
you just
or you can send it to others.
Really?
Because they don't read the names. All they do is they see the petition and it has an X number of numbers, and then they have to send that to I can't remember the name of the department, but they have to send it to a department to approve it, and then they send that back to the MP. So it may or may not be approved for whatever reason from that department. So, and it could just be because the signatures are wrong, or yeah.
Because if the signatures if we don't require original signatures, then it's so much easier to get a bunch of signatures. And I'm not.
Yeah. Well, yeah, and that's why Catherine has suggested that we do that. We can send an email out with the form, the petition form for the signatures, and have people sign it. And if they're in the same area, they can always drop it off in a mailbox to you or send it back via scan, as long as it's a good scan and you print it off in color. If the signature's in blue, then that should work. And again, if people live in the area, in your area, they can always just drop it off in your mailbox as well. So I see that Petra's back.
Yeah, where did you lose me?
Oh, right there, right. Oh, no, go back. There. Yeah, you were just finishing up here.
Okay, I'm sorry, the internet here sometimes when everybody gets home, it gets sketchy, unfortunately. So hopefully we'll be fine. Yeah, so I was talking about the image of our loved ones here, and that last year we know that about 11 people died in Canada from an overdose every day. The only thing we know for this year that it will be more because of the intersection between COVID and the overdose crisis. And what has happened in every province, and we don't have good data from every province, that public health measures that are designed to stop the spread of COVID-19 are in fact increasing the risk of an overdose, because we tell people to isolate, to stay home, to stay away from others. And anyone who knows your loved one, when, you know, social isolation makes substance use works. It makes it harder to stay in recovery. People need connection. They need support. So the isolation and the measures that are part of COVID, in fact, increase a risk of relapse and increase the risk of an overdose. Then we have disrupted supply routes, which means that the drugs that do arrive are of a different mix and mixture than what we've seen before. And one thing is for sure, they are more toxic. And then of course, we have a continued criminalization for people who use drugs and a limited access of safe supply, which would cut out these toxic drugs. So all this has resulted in BC and Alberta and Ontario having record numbers, and the other provinces won't be any different, I'm sad to say. What is the response from our government? The federal government has done something they call COVID prescribing, where they have made it easier to get an access. They have actually changed the Controlled Substances Act so people can get safe supply and prescription. I'll explain more about safe supply at the moment. They funded more safe supply initiatives. They fund research into support groups, but they are refusing to consider decriminalization. Trudeau calls decriminalization no silver bullet. Well, we are not really looking for silver bullets. We know that decriminalization alone will not do much by itself, but in conjunction with other measures, it will make a big difference, because nothing really criminalizes people like having a criminal record. Criminalization creates harm and stigma, and it means that people hide their use. And by hiding, we know more people use and die alone. The numbers on this infographic here illustrate the harms caused by criminalization. And you might be surprised to hear how many people still get arrested for possession. These are numbers from 2014 to 19. We always hear people don't get arrested for possession, but that really isn't true. Now, what is interesting, the Minister of Health could, under the Public Health Act, issue an exemption from the Controlled Substances Act, and indeed decriminalize people who use drugs, or decriminalize the personal possession of drugs, or drugs for the possession of personal use. If the health minister, the federal health minister, wouldn't do that, municipalities can do it. They have the power to ask the Minister of Health for an exemption. You might have heard that Vancouver is planning to do that. It's before council, and we hope that it will go through. Long-term, Parliament will make a change. The decriminalization is a fundamental goal for us, one that we work for. And the main reason for that is that we hope that by decriminalizing, we can shift funds from the criminal justice system to the health and social system, where it really can help people instead of harming them. I said we'll talk a bit about safe supply. Now, what safe supply is really is pharmaceutical grade alternatives to toxic street drugs. And we often talk about opioids, but really safe supply covers pretty much any other drugs as well that people may use. Like for opioids, you could substitute with hydromorphone, for example. Stimulants, you can give people dexedrine. For benzos, you have diazepam. You can give people alcohol, tobacco. All these fall under a safe supply, where a person can get a prescription, and that will allow them to safely also isolate at home, use safe drugs without the risk of these toxic street drugs. Now, one would think that during COVID, we have safe supply projects going on everywhere, but that is not the case. They're mostly right now happening in British Columbia, and a few in Ontario, and there are a few in the Atlantic, a small project in the Atlantic provinces as well. But really, we think that this is one area where actually even more lives would be saved than with decriminalization, but the biggest effect we would have when these go hand in hand. If you look at harm reduction, we talk about harm reduction a lot. And what is key when we talk about harm reduction are really the relationships. What it is designed is to keep people safe and minimize the negative consequences of higher risk behavior, such as using substances. But it's not limited to substance use. We wear seatbelts, we wear helmets, now we wear masks. All this is harm reduction. And harm reduction does not encourage drug use, as we are often accused of, but it accepts the reality of it happening for the person. And harm reduction is essential because many of us have learned in the most painful of ways that people don't recover. I have not heard from one loved one that their loved one kept using because they had access to a consumption site or naloxone. although the naloxone claim was falsely made by the Alberta Minister of Mental Health and Addictions a year and a half ago. But I have heard from families at the supervised consumption site or SCS kept their loved ones safe, connected them to services, even had them help find recovery. An SCS can't be the only solution, and they're not for everyone. Many people who do not have a home do not use an SCS. People who are casual users don't access an SCS. But we feel strongly that they're a vital piece of the puzzle in the public health response to this crisis. And they're a very effective component for the individuals that use it, and by extension, also for their families. You may hear the argument that the majority of people who die in their home. While this is true, about 30 to 40%, depending on the province, of those who die did not die in their own home. And in the absence of safe places, people use and die in unsafe places. These examples I got from our membership. Recently also, 2 people died in a porta potty. And imagine the pain this added to their family's grief. In 2019, I prepared for the Alberta Supervised Consumption Site Review, and I conducted a survey of our families and their thoughts on supervised consumption site. And this quote here is from that survey. If there was a SCS in the site where my son lived, or rather where he died and was homeless, if there had been, maybe he wouldn't have died alone, shooting up in the back of an old bus. This is a very blunt and clear statement from this family, but about the difference the SCS could have made, but sadly did not, for their child. Now, when we switching gears a bit here, when I give presentations, I'm always asked, how do you respond to substance use? I give a lot of talks to young nurses, or nursing students rather, and they always ask, what do I do when I suspect or a friend have concern? And of course, this is a question we've all dealt with, and we all know it's not easy, it's not simple. But the start is to speak to the person and express your concern and be factual, and don't blame the person. Importantly, also, don't make your support conditional, because if you make your conditional, like I will buy your groceries as long as you don't use, then the person needs groceries and they will hide their use, and you have a harder time saving them. Stay prepared that they have a high chance of relapsing, and respond without judgment. Relapse is common during recovery, and what we really have to focus on when we talk to people is focus on staying safe. If a family tells me that they have a loved one who's using, the first question I ask what they're using, of course, but I also ask, do you have a naloxone kit? Get a naloxone kit. That is so important. Thinking about young people and substance use, what should we tell young people? The bottom line is we should tell them the truth, because they have something called the internet, where they can get the information if we don't give them the straight goods. And if we take a harm reduction approach to drug education, it discourages young people from using alcohol and other drugs, but offers more than abstinence-only solutions by providing them with information to keep them safe and keep others safe when they encounter the substance. So often, again, this argument, harm reduction encourages or condone use. Not at all. It's designed to keep people safe. We use factual education when we introduce harm reduction, classes of substances, their effects, side effects, benefits and harms. And yes, drugs have benefits. That's why people take them. and we can't ignore those benefits, but we have to balance them against the harms and be aware of the side effects. An opioid, people often say, makes you feel like you're wrapped in a warm blanket. But if you take too much of an opioid, you stop breathing, like Danny did. We have to talk about peers and social situation. Of course, the intersection between substance use and mental health, because so many young people like Danny start using to self-medicate. If you look at harm reduction for young people, really for anyone on a continuum, our goal, of course, would be to abstain. And use less. The next step would be to use less or less harmful substances. For example, cannabis is less harmful than methamphetamine or opioids. Getting people to use less or less often, then using in a less harmful way, like inhaling or ingesting or smoking is less harmful than injecting. And never, never, never use alone. That is a message we absolutely must drive home when we talk to young people. It's like, and I was in school and we started with sex ed. We were told that sex ed would cause promiscuity and unwanted pregnancies and all this, but it wasn't true. And that's the same with good drug education. Now, I always review the drug user safety rules with young people when I speak to them, or with any audience when I speak to them. Of course, the number one, don't use alone. Test your supply if you can. Testing depends a lot what you want to use. If you want to use cocaine and you test for fentanyl and there's fentanyl in it, it's probably not good cocaine. You probably don't want to use it, or you start with a tiny, tiny amount. But if you're looking for fentanyl, then testing for fentanyl is not very effective. There are not good tests for the strengths of fentanyl. You'd have to have equipment like a mass spectrometry or something like that. But testing is important. Know your limits, avoid mixing, and always keep naloxone with you when you or others use. And of course, explain to people that you can't give naloxone to yourself. There needs to be somebody there. With the signs of an overdose, there is good information on the Toward the Heart website here. And those are all also linked from the Mom Stop the Harm website on drug safety. For me, the sign of the overdose, the most important thing is you can't wake the person. You suspect substance use and you can't wake the person. The choking and gurgling sound, a lot of people have reported sometimes, like young people hang out with friends and they think maybe their buddy is sleeping it off, and those could be early signs of an overdose. So these are these signs, but then the waking, and if you can't wake somebody, try like a sternum rub or a pinch, something like that. Now, if you can't wake them, the response to an overdose is save me. It stimulate, airway, ventilate, evaluate, medication, and evaluate and support. Medication in this case is naloxone, which in most provinces is available free. In most provinces is given out without you giving your name and healthcare number. I know some of our friends in provinces like Manitoba are still struggling with that, but they're working on it, and having it widely available should be the gold standard. And there's research that shows that the more naloxone is distributed, the more overdoses can be prevented. I always carry mine with me. I even snuck my naloxone into Germany, even so here I'm not supposed to have it. And I just have a little nasal one that I keep with my hand sanitizer and the masks and all the COVID stuff. So an important piece of legislation is the 911 Good Samaritan Overdose Act. I know several mothers whose kids would be alive today if their friends would have called for help when they overdosed. In too many cases, people do not seek the help because they are afraid of persecution. This act was passed in 2017, and it protects people from possession charges in an overdose situation. And the intent of the law is, of course, for people to encourage people to call for help. For me, it's a small step towards decriminalization. It is, in fact, decriminalization. It shows that we can do decriminalization if we want to. And no, Prime Minister, it's not a silver bullet, but it's one of the many tools in our toolbox. There are still challenges. There are challenges with the interpretation, with people knowing about the law enforcement not acting correctly. And we have to educate more people, and we need to save lives rather than locking people up. What is interesting that our board member, Maria Gioritis, together with an Ontario mom, was instrumental in having this law passed. She went to Ottawa and spoke before the Senate, and she worked with MPs on this.
Petra, just letting you know we're at about 36 minutes.
Okay, well, we have to deduct the time that I missed.
Yeah.
We need to redefine recovery. People recover from substance use if you used evidence-based proven treatment approaches combined with harm reduction measures. Some people outgrow their substance use if they mature or circumstances change. Although with the current toxic supply, few people don't live long enough for that to happen. In these photos here in the middle, you see Keegan and his mother, Susan. They live in Alberta, and Keegan is a patient in the Opioid program, and that stands for Injectable Opioid Agonist Treatment Program. And people who inject their drugs and have not been able to find other treatments that work, for them, they can get a daily dose of hydromorphone on prescription through the Opioid program. Keegan said that Opioid gave him his life back, and Susan says that Opioid gave her son back. He's now living in an apartment. He's finding long absent stability and quality of life. Sadly, Keegan's safety and that of many other Opioid patients is at risk because this program is scheduled to be closed at the end of March. The Alberta government will cancel it. He and others are taking the government to court. They've challenged a lawsuit, and you see the link here. You can read more of that, and you can also donate to that lawsuit. On the left, we have our friend Guy Felicella. He's a powerful advocate. In a TED Talk, he explained that a nurse at Insight, the first SCS in Canada, saved his life and how he subsequently found treatment and recovery. He has a beautiful family thanks to both. People I know take a daily dose of methadone or Suboxone. One of them is our friend Garth Mallons from Crackdown Podcast. He's sitting here with Leslie. This picture was taken in Edmonton when we had the stimulus conference. Daily methadone is part of his health regime. He's done this for probably 16, 17 years. Just like other people take their blood pressure meds or insulin. Besides being one of the most outstanding journalists, he's also a PhD student in UBC. And if you meet Gareth, and you would never know what he needs for medication. It would be great if I had another photo here from somebody taking safe supply. Recovery doesn't have to mean drug-free. Recovery means being free from the hustle that comes with when you buy substances on the street and all the activities that come from getting the money to do so. It may mean drug-free for some people, but if we make what we call clean the benchmark, it costs too many lives. And for too many people, it's an unrealistic goal. Danny came close to reaching recovery. He had hopes and dreams, and he wanted to plan a cooking workshop for Camp Firefly, a summer camp for LGBTQ youth that he had attended. He planned to ask his head chef about creating job opportunities for marginalized youth, and he wanted to plant more fruit trees at our cabin. All of this did not happen. Earlier in my talk, I talked about stigma. And of course, criminalization is the biggest stigma, but there are little things all of us can do. And a big one is language. It's a simple step in reducing stigma. Model non-stigmatizing language to others and correct people if you can, if you're in a situation you feel that is okay. What you should use is neutral, accurate terminology that describes substance use without labeling or negatively describing it. Use people first language, like people who use drugs, and focus on the individual, not the action. Now, you may find that somebody who uses drugs may use different terminology to describe themselves. Some people call themselves as I'm an addict. And if the person describes themselves in this way, this is their decision and they're right, but we should not do so. But we also have to consider these phrases. I find these really helpful. How are you doing instead of are you still using? I wish I would have known that one. I don't know how many times I asked Danny, are you still using? Are you using, Danny? Are you using again? Not helpful. What support do you need? How can I help? These are good questions that we can ask, and you can see the others in the brackets. So speak to the person first before you talk about their substance use, and use language that shows respect and concern rather than judgment, and acknowledge that wellness is an ongoing process. There's an excellent tool on stigma, and with me an online tool, even a little online workshop on the CCSA website that you can look up. Now, after Danny died, when there weren't any warnings from the health system, when there was nothing happening, but I read in the media that more and more people were dying from substance use, especially from fentanyl, I started to reach out and share Danny's story. And through one of my media stories, I connected with Leslie McBain and Lorna Thomas, the other two co-founders of Mom Stop the Harm. So at first, there were 3 of us in 2016. Now, Angela, we are around 1,700, just under 1,700 families Canada-wide that are part of our organization. Now, any other organization would just say, wow, I'm so proud of this. But for me, it just represents the incredible hardship and the pain and the grief that all of us face. But the good part of it, it also is our story about speaking out. Now, as families, we know we all face challenges. One of the challenges is setting healthy boundaries to protect our loved ones who are using, but also other kids and ourselves, the family. Substance use has a huge economic strain. Lost time of work, paying for drugs. Yes, we have families who've paid for drugs because the dealers threatened their kids. We pay for treatment, you pay for legal costs, and ultimately we pay for funerals. Social isolation from family and peers due to stigma associated with mental illness, addiction, and criminalization. And we care for loved ones who may have suffered a brain injury or other health issues as a result of their substance use. And we face adverse health issues. Families who had a loved one die from substance use also suffer from complicated grief related to the stigma and guilt. Our grief is more intense and the intensity is prolonged. We feel out of place and stigmatized in other grief groups. That's why we have our Healing Hearts groups, and Angela can tell you more about those. Many of us may need trauma counseling. Because of our complex grief, we experience more physical and mental health problems. You can get our Gone Too Soon booklet on our website. This Leslie McBain was instrumental in bringing this booklet about, and we have Alberta versions working on a Quebec version. Download that from our website if you know somebody who's recently lost someone. Now, what do we do as Moms Stop the Harm? We really do 2 things: advocacy and peer support. Now, when I started out, it was all about advocacy, and it was Angela who reined me in and said that people who are in the midst of their grief will have a hard time being effective advocates. So we realized we had to provide support. We have our Healing Hearts group, we have our closed Facebook groups, you know all about that. We have the Stronger Together project that's working in BC and that we're hoping to expand to the rest of Canada, including the Holding Hope peer support groups for families who still have loved ones using. And we meet up locally, of course, not at the moment, but without COVID, we did meet up locally. Here you see some examples of recent advocacy activities. You see our board member, Maria Giridis from Saskatoon. She's covered in a blanket that bears the image of her son, Kelly. The blanket you can get as a fundraiser from Prairie Harm Reduction in Saskatoon. And in a recent interview with the CBC, Marie shared, "When I look at the angel, I see not only Kelly, but all the kids that have gone before him and since, and I see our efforts to turn that thing around." Thank you, Marie. Here you also see Lori Hatfield, Kim Porter, who was on this call, and Kari Canvas, who volunteered at the first ever unsanctioned overdose prevention site in Alberta's history. And the people who were at the site really said they were happy to have some mom time there. And these volunteers also worked on diffusing situations, gave out snacks, helpful words. So really proud of the work they did. In purple, we have the images from Overdose Awareness Day from the banners. Here you see, we had banners in cities across the country. Here you see Faye Gray's daughter, Lindsay, and Jasmine Blake's children who mourn their dad. The white Christmas tree holds out ornaments with images of our loved ones. Dalarna Treloar, she's from Powell River, BC. She had the first one. There will be trees across BC. If you want to have a tree in your community, it's easy to do, and Darlana can explain how, and Jennifer can also make a connection. As advocates, sometimes you may think, I'm the only one in my community. How do I do that? And what I learned is that we are stronger together, but not stronger together just as moms. Actually, as moms alone, we are quite weak. We need to get together with other like-minded people, like organizations of people who use drugs, such as Kaput, drug policy organizer, harm reduction providers, academics, healthcare people, like-minded organizations like groups like Friends of Medicare, and politicians who work for our cause. We are a non-partisan organization, but we always seek out help from politicians. Earlier you talked about the petitions. There are politicians who present those for them. And the way things are right now with the numbers, it is quite dreadful, but we have had wins. And here are some of those wins that Mom Stop the. We, together with many other organizations, or many other organizations with our help, these are some of the wins that we've had. Making naloxone available without prescription was one of the first things we fought for. Getting more SCS. Already earlier mentioned the Good Samaritan Law, having more evidence-based treatment. Right now, Leslie and a group of moms is working on treatment regulations in BC, safer supply, and of course, the decriminalization initiatives we are also supporting. As part of our advocacy work, we work with scientists on research projects. And one of these research projects, 43 moms from across the country were interviewed for this. And some of them are on this call today. And there were interesting findings why we engage in advocacy. The number one is to save lives. Those of us who have loved ones struggling and those of us who have lost loved ones, the number one thing we want to do is we want to save lives, but we want to reduce harms from substance use. Some also state the goal that they want to reduce substance use themselves. We want to enhance kindness and empathy and work against stigma and shame and change harmful policies. And then, of course, we also want to provide mutual support to families. There is a report available on our research, and if you, it's on our website. And for those of you who participated in it, or if you are really interested, Jenny can also send you a hard copy. Jenny is Jennifer Howard, our program manager. You can reach her at info@momstoptheharm.com. Now, as part of this research project, we also had what researchers call a knowledge translation project. And there was a public awareness grant from the government of Alberta, the previous government, I must say. And our research team, we developed short digital videos to share messages. And our theme was what families want to know about opioids, stigma, and harm reduction. We developed and we filmed the See the Lives video series. And there was Phil Hogue. Phil is Lorna Thomas' co-founder's husband. There's Kim, who's on this call tonight. There's Donna May from Moms Do. And I participated as well. And all of us lost children to substance use. Phil's son died from substance use related suicide. You can watch these videos on the CBeyond website. Kim can probably confirm it was the single most difficult advocacy project I participated with. And writing that letter was hard. Reading the letter was harder. Having it read back to you was brutal. And I said to the film crew, I said, one take. And I think they did it for us with one take. So there's also a study guide, and this CBeyond project is being used widely by health professionals and others, and you can find it on this website, and please use it, please share it. It's there for you. Now, what do we stand for in our advocacy? What are our main goals? I've talked about some of them here already. We, of course, want a safer supply of substances so people don't die from toxic street drugs. We want to decriminalize. We want full access to harm reduction in all provinces, not just in BC. In Alberta, harm reduction is cut back and rolled back and is being destroyed. We want evidence-based treatment. Yes, abstinence-based treatment is part of that spectrum, but it's not the most effective treatment for opioid use disorder. And we need to offer people what actually works, and we need it for free and without extended waiting list. And of course, upstream prevention. That is a big job. Dealing with mental health, with trauma, with poverty, with stigma, with discrimination, racism, and all these things that we struggle with in our country. Just to explain the pictures, this collage was done as part of our election memes, where we encourage people to vote for change, where moms from across the country came together and held up these signs, and we put them all together. On the right, we had, there were ongoing protests, even under COVID conditions in Victoria, and Jenny here only took her mask off for a second for a photo, otherwise she wore her mask. And they were protesting in front of the Ministry of Health in Victoria. And the photo in the bottom is was taken by Sheila Jennings, one of our board members, and it was taken in Toronto at the Day of Action on Kaput. So people use drugs. People like our Danny are like you and me, and they deserve a chance to stay healthy and to have a future. Danny didn't have the chance. He's on our mind every day. And I think about the loving, caring son he was and the fantastic meals he cooked. Since he died, my nights are often dull. And when they are, I feel his absence very strongly. I often wonder how different the outcome could have been. It's our collective responsibility to make sure the outcome is different for other families. And I sincerely hope that sharing Danny's story and what I've shared here today, and you sharing your story, will help make that happen. And I'm glad you're here. The message I always give my nursing students is, I'm glad you're here. It's a message I want you to give if you're at the end of a 12-hour shift. Bye, Sheila. If you're at the end of a 12-hour shift and you have to just, you're tired and a person walks in with substance use related problems, instead of going, the message you give, I'm glad you're here. That's a message we want to give from the health system. The photo is the last meeting in person we had in Vancouver. And I'm just going to get back. I realized that I forgot to introduce the other, did I introduce all the projects? Yeah, I introduced all the projects, I think, yeah.
Yeah,
So,
you did.
yeah, so sometimes I question myself. And here, of course, you know our social media, where you can help. Another little big thing you can all do is on our public Facebook page. Every time you like something, every time you comment on something, every time you engage with the public, you help get our message out. So that's a big little thing you can all do. And now I'll stop sharing my screen. And and then we can see in the chat. Are there any questions, Angela? You were going to look at the questions.
Actually, there weren't a lot of questions, just a couple of comments. One comment was about safe supply and how difficult it is to get, safe supply. Maybe do you want to talk a little bit about that, Petra?
It is something that it's incredibly challenging, and it's incredibly frustrating. It's really, really frustrating because the federal government has opened the door for safe supply, but it's really up to provinces to get it to the person. And we find the barrier is often the prescriber. The barrier is often physicians who have been so drilled it into their head that they shouldn't be overprescribing opioids, that they have the hard time wrapping their heads around safe supply. Then the other barrier is pharmacies. And right now, overprescribing is not an issue. 94% of all people die from toxic street drugs. That's why safe supply is so incredibly important. It really will need pressure, provincial pressure, federal pressure. I have suggested to the federal Minister of Health that they should withhold transfer payments unless provinces get on board with certain programs. They won't do that, of course, but they can take similar measures like tying certain money to certain action, and more of that needs to be done to make safer supply more widely available. If you in Ontario and Toronto, there are some brave physicians who are prescribing. There are some in Vancouver and Victoria, and there's also the MySafe project with the dispensing machine. But this is something we really, really need to put pressure on.
Julie Cochran has a quick comment about safe supply. Maybe Julie, if you want to ask that
Unmute
question.
yourself.
Yeah,
Yep.
yeah, just a quick comment, because I know it looks like it is, the safe supply is that magic answer. And as some of you know on here, we've been working on a project around that. And some of the anecdotal comments we've been having back from people who are on safe supply is it's not what it needs to be, because it's not providing people what they want. It's all pill form, and not many people who are using illicit street substances are using pills, and it's not giving them the effect that they need, the degree that they need. So safe supply, from what it is right now, from what doctors can prescribe, if they are at all, needs to be a lot different.
That is such an important point, Julie, and one that people always point out that, if you've been using fentanyl for the last few years, a hydromorphone pill is not going to cut it for you. And also, when we look at safe supply, it's really a harm reduction measure. It is not treatment. And we have to stop thinking that getting a high is a bad thing. Like some people use because of trauma they have experienced, and for some people their life is so unbearable if they don't use. So if that person wants to get a high with their safe supply, not just stave off withdrawal, who am I to tell them that that's not okay? So people call for actually having, you can get real heroin. It's made in Switzerland. Diacetylmorphine? Yeah, it's it's expensive and hard to get here, although legally possible. So we would need to make that locally, or rather not locally, make it in Canada. And we also should make fentanyl, safe amounts of fentanyl, available for people who depend on those drugs. What's happening right now with some of the hydromorphone, it's diverted. And that's not a bad thing either for those people who need hydromorphone, because it's better to get the hydromorphone that comes from the doctor than the stuff that comes from the street. Yeah, thank you, Julie, for that.
We have a quick question from Christine Sander, and then one more after that, and then I think we'll sign off.
Yeah, okay.
Yeah, hey. I wonder a little bit, who can you get naloxone?
Who can get naloxone? In Canada, anybody can get naloxone. Anybody.
Oh.
So naloxone needs to be in the hands of, like if a person uses, their friend needs to have naloxone, their family needs to have naloxone.
I'm agreed with you like that. But in Sweden, just now, in my city, they have started to get out naloxone in the needle exchange, but they just have open 4 hours in the week.
Oh.
And not for us, it's just the users who can get. And I say to a little activist, get the naloxone even if you take amphetamine or something, and give to your friends or parents and go back and get a new one. For me to get to parents to give out like an activist, I must get from someone. They send from another country to us.
Yeah.
So
There's your first goal. I mean, for us as well, we couldn't get it before, but now it's given out at pharmacies, and they also give you a bit of training when you get it. So definitely work towards that. Naloxone needs to be in the hands of others. And of course, the people who give it to others. That is great, but it needs to be in the hands of everybody. Yeah. And then who has the other question from Sandra?
Julie H has a question. She just needs to unmute.
Hi, thank you. I do have a question. I was considering on the Overdose Awareness Day. I had only just heard about it this year, but I was thinking of doing a purple sidewalk in Airdrie. I'm from Airdrie, to go along with the Pride sidewalk. And I talked to Pride, so she's going to help me, but I want to know how I can get Mother Stop the Harm to help with this, if I can use your logos or how that works.
Yeah, Julie, you've got my email. Email me back. I'll get you into our Alberta chat.
Okay.
We have an Alberta, are you on Facebook?
Yeah.
Yeah, we have an Alberta Messenger chat where we talk about all kinds of things. This year, Overdose Awareness was a little different. Like everywhere where events get organized, it's because there are local people who do it. And we help you by publicizing and giving you idea, but bottom line, it's down to you. But in Airdrie, you're not far from Calgary. And you can, and I think we have other members in the region as well, either in Airdrie or near Airdrie. So we can connect you, and getting you into our Alberta Advocacy chat is really what we're hoping with these Zoom meetings, is that more of you will be inspired to do something where you are. And it can be a letter, like one thing with petitions. I don't know, Angela, if you mentioned the municipal petition.
No, I didn't.
We have sent petitions to each and every municipality in this country using a mailing service. They are similar to the petition that go to the MPs. And if the municipality votes on it, they also send it to Parliament. So what all of you can do, and the information on that is on our website, and there'll also be a newsletter on it. or mail out on it. Each one of you can call your alderman or counselor or your mayors, reefs, whatever you have in your community, and follow up on that petition. Say, hey, you have that. Are you going to discuss it? Are you going to vote on it? And so there's a lot we can all do, but each and every time you do something, make sure you share your story, because that's what gets people to listen. And that's really where the power is. And that's, like Marie said, you know, it's Kelly the angel, and it's Kelly and all the ones before him and since. And yeah, it's the work they do, and we are kind of their instrument to make that work happen. And wow, this is the biggest meeting we've had, and I thank you all. And I'm so sorry about my wonky internet, but I'm sure Angela had enlightening conversations.
Thank
While
you,
I was
everybody, for
nervously
joining.
looking at my modem saying, come on, reboot.
Thank you, everyone, for joining. We'll have a video of this up available in a couple of days as soon as we can get it edited. And if you have any questions, please email us at info@momstoptheharm.com. We will have a survey that will come out in the next couple of days, just on the presentation, what you felt.